Awesome.
Yes.
Welcome, everyone. For those of you who don't know me, my name is Kelly Nevins. I am the CEO of the Women's Fund of Rhode Island. This year is our 20th anniversary, and I am so proud to be connected to this organization and our mission, which is to invest in women and girls through research, advocacy, grant making, and strategic partnerships designed to achieve gender equity. And tonight we have the privilege of presenting a year-long worth of work by literally nearly 100 volunteers from around the world, in fact, who have helped us to put together Rhode Island's very own Women's Wellbeing Index. And in the chat, you will see a link to the index, which will take you to our website that you can peruse at your leisure. The index looks at 5 different screens of how well women do compared to men in each city and town throughout Rhode Island on measures such as economic security, employment and earnings, personal safety, health, and political empowerment. And literally, it took a small army to put this project together. Most of the data that we pulled from comes from federal sources. Some of them are local sources. The data, a lot of it came from the census. And so I just want to note that in some cases, our data is not within the most current year because the census data has not yet been released. And we plan on updating that when it does happen. For that reason, when you are looking at the Women's Wellbeing Index, and within each of those 5 categories, you'll see 5 additional measures that fit the health category, personal safety, etc. You will also be able to download policy briefs that go into a little bit more detail and some of the more recent data that we did have available that wouldn't show up in the index, along with policy recommendations that we believe would help to go towards helping to correct some of the inequities that the index is lifting up. I know people are still filtering in the room, but I do want to recognize that Secretary of State Nellie Gorbea has made some time to join us this evening, or she will. Secretary Gorbea has been a great ambassador for the Women's Fund. In fact, she at one time served on our board, and she has often said that it's because of the research that the Women's Fund put out that led her to run for office, because she felt like something needed to be done. And so she decided to help work towards solving those inequities through political empowerment. So we are so pleased that she did that. Representative Teresa Tanzi is also slated to join us this evening, as well as Aaron Arcand, who is from Senator Reed's office. And if I see that any of our other legislators have joined us, I'll make sure to call them out. But if they're here now, they can also just say hello in the chat box. The research project that I talked about is a big and bold project. And earlier in 2020, when we talked about doing this at the board level and then at the policy and advocacy committee level, I had said, you know, this is going to be a huge undertaking. This is not an easy project, and we should not embark on it if we don't think that we can do it. And we got a resounding, we should be putting together this Women's Wellbeing Index. The information is really important. And furthermore, it's really great to be able to see how our cities and towns compare to each other. The research needed to be funded, and it would not have been possible without funding from the Craig Newmark Foundation, as well as the Nordson Corporation Foundation. So I just want to note that it is because of those sponsorships and grants that we were able to do this. And I also want to take a moment to just really applaud Ellie Brown, who is our operations and fund development director. And she is the person who project managed this pretty much from day one. And without her, I don't think it would have been possible. So thank you, Ellie, and thank you to all the volunteers who worked on the technology, who worked on the policy analysis, who proofread for us, et cetera, et cetera. So thank you. All right. So it is my pleasure to introduce very quickly our panel and our moderator. You can see in the slideshow that we have been posting the bios. We're not going to go through them, unfortunately, this evening. It takes up a lot of time to do that. But I do want to note that our panelists include Angela Kemp, who is the Director of Prevention and Special Projects at Day One. Dr. Deborah Perlman, who is an associate professor of the practice of epidemiology in the Department of Epidemiology at Brown University School of Public Health, and Nishi Kumar, who is a policy researcher focused on building healthier, more equitable communities, and is currently holding the role of manager of policy at Rhode Island Housing. And last but not least, our volunteer moderator for this evening, Paige Clausius Parks, who is a senior policy analyst at Rhode Island Kids Count. And so I'm going to turn this over to Paige. She's going to moderate a great panel discussion. As we wrap, we are going to go into chat rooms, so everybody has a chance to talk a little bit about what they heard and saw, and then we'll come back for a closing. So thank you everyone for your attention and participation. And if you are not on the panel this evening, I would just ask that you put yourselves on mute at this time. Paige, take it away.
Awesome. Thank you so much, Kelly. And thank you, Ellie and Kelly and everyone at the Women's Fund for inviting me to moderate today. I'm really excited to be a part of the launch of this really important index. And I'm also so thrilled to see so many friends and familiar faces on this Zoom meeting. I think we're going to have a great discussion, and so thrilled to be part of this event. So the format that we're going to use today is that I have some prepared questions for our amazing panelists. And I'm also going to ask each of you that are watching the Zoom call, please conversate on the chat if you have additional questions, thoughts, things you want to ponder. I'm going to thank Imogen in advance because she's going to help me go through the chat as we're moderating the conversation, and I'll be able to add in some of your thoughts for further discussion. So let's kick it right off because I know we have some great discussion ahead of us. So for our panelists, so for Nishi, Angela, and Dr. Perlman, this question is for all three of you. I would love for you to each please to just briefly introduce yourself and share your connections to this well-being index. Anyone wants to start, or go ahead, jump on in.
I don't mind starting, and for today's absolutely wonderful and very exciting panel, please call me Deborah, so I'm not that formal, but it was very nice that you introduced me that way. So I actually have been working on women's health for many years, and being part of this panel was particularly moving because seeing data that was women-centered is not common. A lot of the data that I use, and I use a lot of different sites, you'll see gender as a variable that you can look at, but the data itself is collected at the population level without necessarily focusing on women specifically. So I want to just stop there and applaud everybody who worked to make this a reality today.
Thank you, Deborah. Nishi or Angela, jump right in. What is your connection? And you can introduce yourself briefly as well.
Sure, I can jump in here. My name is Nishi Kumar. I work with Rhode Island Housing as their manager of policy and research. And my connection to the index is that a few months back, I heard about it online and I sent an email to Kelly and Ellie and said, this seems really cool. Any chance I could volunteer with it? And so I was able to join the volunteer team, which were all just a fantastic team of volunteers. As Kelly said, really a small army that worked really well together and really closely together to get this project to the finish line. And I think part of the reason why I wanted to be involved is for exactly what Deborah mentioned, that it's really challenging to find data and resources that focus on women's well-being. And so I think this tool fills a really important gap in the state. And again, a huge thanks to Kelly, Ellie, and the whole team of volunteers who got this project through the finish line, especially the folks who worked on the data analysis and getting it cleaned up and getting it into this beautiful, easy to use dashboard. I know that that's often one of the biggest challenges in pulling together this type of tool. So congratulations to everyone, really.
Awesome, thanks. And that's a great plug for volunteering. So if anyone wants to be involved, there is so much work to do. And I know the Women's Fund really greatly relies on some wonderful volunteer effort. So please join in, and thank you for volunteering on this project. Angela.
Thank you, Paige, and thank you to my fellow panelists and the Women's Fund, the hundreds of volunteers that it seems like put this work together. My name is Angela Kemp. I use she, her pronouns, and I am the Director of Prevention and Special Projects at Day One, which is the Sexual Violence Trauma and Resource Center for the state of Rhode Island. I'm a macro social worker by trade, and I am a volunteer with the Women's Fund on their Policy and Advocacy Committee. And I joined the committee when this project was proposed, so I was really happy to be a part of conceptualizing and planning, helping source data for this project. We actually were able to provide some of our data from our statewide helpline, which is the collaboration of the Black Zone Advocacy Center. And then I was also able to work on some of the public safety policy briefs. So I've been really happy. I echo Deborah and Nishi's sentiments about how much this data is really needed, and this holistic approach at looking at the well-being of women.
Wonderful. Thank you so much. So my next question is for each of you as well. And I encourage everyone who's on the Zoom call to please take a moment, click on the link so you can begin to search around the index, because our questions coming up will be in reference to some of the data that's in the index. So you may want to be perusing through as we discuss it. So for each of our panelists, I would love for you to share a little bit about the data that is there and the data that is missing. So many of us know that missing data can many times tell us a very important story as well. So I would love to get your thoughts, opinions about what data do you think is missing from the index, especially in your area of expertise. I don't know if anyone wants to go first. I know Deborah spoke first last time. I don't know if you would like to speak first again.
Have to remember to unmute. So it's really interesting to me to think about what other fields we would want to see. And I want to focus on two things. The first is that we could focus on diseases that are specific to women, breast cancer being one. And of course, I'm sure everybody here in the participating today knows that advanced stage breast cancer has incredible disparities, with low-income and poor women and women of color being diagnosed at much later stages. And that's really an access issue that is just so preventable. So we could focus on, and I do a lot of work in chronic diseases, we could also focus on things that are not female specific, not women specific, but affect women differently. An example I'm going to give is mental health. We know that anxiety and depression, and some say suicidal ideation, present themselves more often in women than they do in men. Things a little different with adolescents. So that is an area that I think we could explore. And then I just don't want to take too much time so everybody can speak. Another thing that I'm really, now that we're in the middle of a pandemic and maybe in the pandemic for quite some time, I've been thinking about where are the data sets we could go to where we would really dig into questions around economic security and financial well-being, which definitely affect women differently than men, and especially older women. So I'll end there. There's so many fields we could add, but we also have to think about where are the data, how current it is, and how it can be analyzed so it's Rhode Island specific.
Those are really great points. And thank you for also bringing up how the pandemic is going to affect a lot of our data and the different questions we need to be asking as well post-pandemic. So thank you. Nishi, you're interested, or Angela going next?
Sure. I agree wholeheartedly with Deborah. I mean, for all of the fantastic data that's built into the index, there's always more that could lend more context to the trends that we're seeing. I think one area that I would be particularly interested to see kind of across the board would be information on racial disparities between women. You know, I think that when we're talking about economic empowerment, when we're talking about health equity, when we're talking about work and employment and earnings, I think that those racial disparities are really important to dig into more to the extent that we can. The experience of women of color in Rhode Island and nationally is not the same. And so I think that it is important to recognize that there's a broad diversity within women and sort of acknowledge those disparities. I would also say that one of the things that that we came across as we were trying to identify data sources for this index is the limitations of local data. Particularly when it, you know, from my own area of expertise, housing, you know, it does, rent in downtown Providence is not the same as rent in Smithfield, is not the same as rent in Newport, nor are, you know, commute times or access to childcare or any of those other things that come with differences in housing. So I think I would love to be able to dig more deeply into sort of the geographic differences in these data sets. But again, part of the challenge is just what's collected and what's available right now. But I think if we were imagining kind of a dream data set that could be featured in an index like this, I would say that having it broken down with more detail by geography and more detail by race and ethnicity would really lend a different perspective.
Yeah, really great points. Great points. Angela.
Thank you for that, Nishi. I think that there are some excellent points in there about the availability of race and ethnic data. But I think for me, when I was reflecting on this question, Paige, I thought a lot about the limitations of data produced by nonprofits and how that can really feel, data collection can feel like a burden to some nonprofits. It takes away from the time from service provision and especially when we're working with clients, vulnerable populations like survivors, and we often have to balance the need for privacy and confidentiality in the way that we collect data. So the other thing that happens is that we also prioritize data collection based on our grants, right? We collect data based on what we need to tell our grant funders and not necessarily about what it is that we want to know about the issue in which we're working in and how we can necessarily be more effective and understand the issue more. So setting up, you know, data collection structures and monitoring that data takes such an enormous amount of time and resources, and I don't know any nonprofits that are in abundance of time and resources.
Yes, you raised some really important points. And actually one of the questions that I had for you, Angela, directly, so I'm going to piggyback right into the question based on what you've said actually, was the index includes data on domestic violence. And I would love for you to just explain a little bit about the difficulty that there may be in capturing data about domestic violence.
Sure. So for domestic and sexual violence, all of these incidents need a formal report, right, in order to count the incidents. And so formal reporting looks like going to law enforcement, going to a hospital, or going to a victim service provider. And for the criminal justice system, historically, it hasn't provided outcomes for survivors that feel satisfactory and just and necessarily safe. Prosecution can take years, and the process can really be re-victimizing. We do a lot of work with those institutions and the systems to make them more trauma-informed and victim-centered, but we have a lot of work to do. So there are many, many survivors who will never report the crime, the violence that happened against them. There's really strong emotional reactions to experiencing these kinds of violence. Shame is a big one, and not necessarily wanting to be identified as a victim. And often also offenders will use social isolation and threats of violence that really keep their victims from reporting the crimes.
Thank you for explaining that. And as people are going through the index, also keep that in mind. So those numbers are most likely very underreported. So, right. So I have a question that I will direct to Deborah next. So the index indicates that the state average for the percentage of women ages 18 to 64 without health insurance is just over 3%, it's 3.4%, compared to the national average, which is 13.1%, which that looks great, yay for Rhode Island. However, there are also alarming disparities. So we've been talking about now the disparities by race and city town. And I like to kind of dig into that with the health insurance data. So we see in the index that in Rhode Island, only 1% of women in Scituate and Tiverton do not have health insurance, compared to 15% of women in Central Falls who do not have health insurance, which is of course a huge disparity and also above our state average and above the national average. So Deborah, I'm really curious about what you think about this data. What does it tell you? And how would you like to see data like this used and possible policies that can come from it?
Well, I actually want to say thank you because you gave me a gift, because I did do some Googling just to think about what this question that you sent to me today. And I'm actually going to send to Ellie an article for everybody that just came out from in January of 2021 that looks at health insurance actually across the country, but by state, in terms of what are the implications under the Biden administration of the Affordable Care Act and potential expansion of health insurance to those who've been left out. And I wanted to say something that really was so interesting in the article. Rhode Island was one of quite a number of states that took the federal match and did the Medicaid expansion. But the question is, when you do the Medicaid expansion, what level do you set for Medicaid eligibility? Now, Rhode Island is relatively generous. It sets the Medicaid eligibility at about 250% of poverty. You don't want to live in Georgia or Texas because there the level is so low, virtually no one can get in. But the reason why I raise that is because there are a lot of people who are what we might call the working poor, who are underinsured or don't get insurance. And the market that's set up under the Affordable Care Act assumes that people have the money to buy into the health insurance. And I think what we have to do, particularly for women who tend to work in jobs either that don't carry insurance or are relatively low wage occupations, how do we change the safety net, I guess is what I want. How do you change the safety net so that the group of people, women and men, I mean, I really think it's a woman and a man's issue. It's a human issue, who are not eligible for Medicaid, can't afford or don't get health insurance from their employer, so that there are, the safety net is more generous, I guess is what I want to say. Because I think the reason why you're seeing people left out in cities like Central Falls, Pawtucket, Providence, Woonsocket, that's the population that doesn't have the resources to buy into the health insurance for the market, earn just a little bit above Medicaid so that they can be eligible for Medicaid. I think we have an incredible opportunity in the Biden administration to really advocate for changes in the safety net around health insurance, but it is really going to be a challenge. And why I think it's going to be a challenge, because so many resources now are being tied to the pandemic. And there's competition now for dollars and where they're going to go, which doesn't mean we don't keep advocating for it, but I think that's something that's going to be a challenge for us in these pandemic months.
Thank you. Thank you for that. My next question, and before I ask my next question, actually, I'm going to just remind everyone to please feel free to add your questions into the chat. I hope that we have some time to go through them. Thoughts that you have or things that you want some of our panelists to expand on, please throw them in the chat. I see Carlene just did, so thank you so much. Keep them coming. So my next question is for Nishi. It's about home ownership. So the index shows that the home ownership rate for single women householders in Rhode Island is the second lowest in the nation. The home ownership rate for households of color in Rhode Island is the lowest among all the states in the nation. For looking at rentals as well, 50% of all Rhode Island renters spend over 30% of their income, which we know 30% is what economists say is what folks should be spending on housing. But we also see that women in Central Falls and Woonsocket are disproportionately impacted by housing costs. In those cities, fair market rent is more than 60% of single women's median income. So what does this data tell you? And what do you think, what policies need to come from this data?
So there's a lot to say there, certainly in terms of the homeownership statistics that you just mentioned. I think it's important to recognize that saving up for a down payment is pretty much impossible for anyone who is working a low-wage job, anyone who has student loans, anyone who's paying for childcare, which is a whole lot of people. So certainly, I think that's a huge factor that contributes to our low rate of home ownership, especially for women and for people of color. I think in general, the stats that you mentioned, they tell us a lot about the cost of housing, but I think actually it almost tells us more about the flip side, which is economic empowerment and wages and earnings. Cost burden, what you described as cost burden, that people should be spending 30% of their income on their housing. If you can only find part-time work, if you can only find gig work, if you can only find, contract work that doesn't come with health insurance, where, you're paying out of pocket for your medical expenses, then there's no housing that's going to be affordable to you if that's the economic situation that you're in. So I think it's really important to recognize that all of these systems are connected and that we can't have a system that, allows for people to have affordable housing unless we also have a system that offers women equal pay for equal work, that offers economic stability for women, where they can sort of have the benefits of full-time work and that job security. I think that's incredibly important. I do think that there's some low-hanging fruit that we can look at in terms of policy recommendations for housing. So for example, right now in Rhode Island, if you have a housing choice voucher, which is the federal government's primary mechanism for subsidizing housing, if you have a voucher like that, a landlord can refuse to rent to you just on the basis of having that voucher. So you've found an apartment that works for you, you've got the money to pay for it, but the landlord can say, no, sorry, I don't want your voucher. That's completely legal in Rhode Island right now. And that's a program that benefits a lot of low-income women and a lot of low-income families. And the fact that that type of source of income discrimination is legal in this state means that a lot of women and families are blocked out from the handful of homes that they can afford. So that is a bill that's probably likely to show up in our state legislature again this year. It's been introduced, I think, 4 years in a row. And I'm really hopeful that this is the year that it can finally get passed to say that if, that source of income discrimination is illegal, and that renters should be able to rent housing that they can pay for.
Yes, thank you for bringing the source of income bill. So I know Rhode Island Kids Count has testified in support of that bill, and we really thank Rhode Island Housing for all the work you've done to really champion that work and providing the really important data and research that shows how important not discriminating is. I mean, that sounds ridiculous to say, right? But it has a tremendous impact on families and for women and children. So thank you. Kelly also put into the chat that the Women's Fund is championing also the Fair Pay Act. So I would advise folks to really pay attention to these bills. It's really important to have testimony and support of this really important legislation. So Kelly, I don't know if there is a way for folks to continue to be connected, but we'll make sure to find a way so folks can also know when these bills are up for hearing. Okay, so wonderful. Thank you. Angela, talking about interconnected systems, I would love to, I also found it really interesting around some of the data, back to domestic violence data as well, is that there is some occurrences in Rhode Island, domestic violence occurrences. If you look at the data, it directly correlates to poverty statistics as well in the state. So I would love to hear your thoughts on the ideas of what does this data tell us? And if you want to expand on the idea also about interconnected systems.
Sure. So I was not surprised to see this correlation, and but I'm happy to see that this supports the research that we see on the national level. As happy as I can be looking at maps of domestic violence occurrences and poverty. But what we know on the national level is that poverty is a risk factor for intimate partner violence perpetration. It also is a barrier for survivors trying to leave abusive situations, heal from abusive situations. Strengthening economic supports for families is a focus area of intimate partner violence, primary prevention, according to the CDC. And I will use intimate partner violence and domestic violence a little bit interchangeably here. So I'm really glad to see that our local data supports this as well. And I hope that what we can have here is a conversation and have our lawmakers and those of us that advocate to our lawmakers to see those connections between these broader, more root issues that are part of the social determinants of health. And that these policies that we've suggested in the index really have the potential to impact change far beyond just the economy. So when we talk about, Fight for 15, the Fair Pay Act, as Kelly just mentioned, paid family leave, the Rhode Island Works cash assistance increase, we're not just talking about the economy or workplace policies. We're also talking about sexual and intimate partner violence. We're also talking about child abuse and neglect. And we're talking about how we prevent these things in the first place. And so there's a whole other layer of why these policies are so important and the change that they have the potential to create.
Paige, could I just add something though? Angela that was just beautiful, but I really want to ask us all to think about the sources of data that we get in order to see disparities or prevalence of health outcomes, because and Angela, jump in, but when it comes to domestic violence and sexual violence, if the data comes from police reports, we're going to get a different picture of who is at risk for domestic violence or interpersonal violence, because women who have more means use lawyers or have other ways of economic resources to either get out of the home or relocate or whatever that women with less economic means don't have. And I worry about, this is just my opinion, please. I sometimes worry that we're not as self-conscious as we need to be about where the data are coming from or the limitations of the data, and then don't recognize that sometimes we say a certain group of women may be at higher or lower risk, when in fact, we don't have the data to really look at the full picture. So I hope, Angela, that's okay. I jumped in. So it was a question really for you.
No, that's all right. And I had kind of finished my thoughts, so I appreciate you adding to that, Deborah. Thank you.
Wonderful. Thank you so much. And I'd like to turn it now to a question that we have in the chat from Carlene. And she asks this really great question, and I'll pose it to each of you. In your research or in any work that you previously done through the Women's Fund or through your current line of work, Have you identified the single most important factor that leads women to more economic success? So for example, is it having more education? Is it owning a home, a business? What do you think really leads to, if you can identify, the most important factor? That's a tough question. What do you think? There's no right or wrong answer. So just from your experience, what do you think?
That is an incredibly tough question, and I don't know that there is one factor. I would love to talk about one that I think is top of mind when we talk about things like housing, even though it's unrelated and it's actually not represented in the Women's Index. But something that I've been thinking about a lot lately is student loans and the extent to which so women are rapidly becoming kind of the most educated demographic in the US, and more of them are going to college, taking out student loans. And when we consider why people don't buy homes, or why people, aren't able to save for retirement, or why people aren't able to kind of put money into their children's savings, I think that student loans are holding a whole generation of women back from sort of realizing their full economic potential. So that's something that I don't know a lot about, being a housing researcher, but certainly when we talk to people in the housing space about what it is that is their kind of biggest line item in their household budget other than housing, student loans comes up a lot. So that's one that that just comes to mind because it's something that I think we haven't spoken about yet, and something that I don't know is represented in the index right now.
It's a really great point, and also highlighting what data is not there as well. Which story does that tell? Absolutely.
Paige, can I add something?
Sure, please.
Sorry. Yeah, I asked that question. I don't know the answer to that. I just thought I'd put it out there and start thinking about it. But I think as we think of successful women, even in our own personal lives, kind of what characteristics or what has made them successful in their lives, to start thinking about those things and putting into that terminology. Like, what if you look at your peers who are successful, what is it about them that makes them economically successful? And I think if we look at it that way, we'll start to see trends.
Okay. Does anyone want to expand on their thoughts or respond?
I just want to appreciate Carlene's perspective there of coming from a strengths-based and not a deficit in her approach to thinking about policy. I appreciate that very much.
Thank you, Carlene. Again, I encourage folks to utilize the chat if you have any other thoughts or questions or responses that you would like us to discuss. Okay, the next question that I have, and this is one for each of you. What would you like to see added to future iterations of the index?
I can go.
Awesome.
So I would be really, really thrilled. As somebody who does work with a lot of youth in sexual violence prevention, I would be really, really interested to see this index for different age categories, specifically for youth. So I'm hoping maybe a partnership between Kids Count and the Women's Fund, Paige. I'd really love to see some of the data that Kids Count works with gendered and mapped out in the way that the index has been able to. I really would love to know more about girls' perceptions of their local school climates. Yeah.
Awesome, thanks. I like that idea. Sorry, go ahead.
Piggybacking off of Angela's comments, I mean, I think we've mentioned a couple of things that we'd love to see, data sets segmented by age, by race. I mentioned sort of student loans and wealth in general. I think that's a really important piece of the economic empowerment picture. one of the things that I would really love to see, oh my gosh, I just had it in my head and I'm blanking now. Definitely by race, by age, I would love to see more information on women's economic mobility. So, you know, we have how much they earn, we have sort of their educational attainment, but I'd love to get a broader picture of kind of how a broader picture of kind of women's economic well-being and their sort of resiliency to bounce back from sort of economic hardship. So things like, you know, savings rates and that type of thing. I think with COVID, that's become a really important factor. And, oh, this is the one that I just forgot. Caregiving. I think that one of the things that COVID has really highlighted is the degree to which women are still the primary caregivers in the home. And so what happens when we look at an aging population? You know, it's daughters who are taking care of their parents. And of course, when we talk about young children, then we're almost always talking about a female caregiver. So I would love to see more of a picture of the role that women play in sort of caring for their families and what impacts that has on their health and well-being, on their economic empowerment. I think that's a really important picture here.
Great, thank you. And Deborah.
So not too long ago, the Department of Health really, I have to give them the highest credit, found the resources to add to the behavioral risk factor surveillance survey, which many of you know is done every single year, and it's both national and at the state level, and added a module on sexual orientation and gender identity. In order to really begin to understand the incredible discrimination and issues that people face, LGBTQ folks face, you need, however, to collect data over a really long period of time so that you have a big enough population. And I think for some of the things that I was thinking of to also add, if the Centers for Disease Control came to me and said, so Deborah, what would you most like to see in our national surveys? I would say, go find the money and please do oversamples of populations that are not represented in your national data and take it from the Department of Defense. I don't know, take it from someplace else. But what we really, really lack, and this is not something that's going to be easy for the Women's Fund to address either. What happens in our data sets is that the populations that are underrepresented because we don't do the oversampling to hear their voices. And that's an enormously expensive endeavor. So I'm advocating for the federal government to put that kind of resources behind for many issues, whether it's caregiving or transition from adolescence to young adulthood, or whether or not it's the incredible variation within the Latinx population or the populations that I mentioned, because the Women's Fund needs that data to be collected in order for us to really build the index. So it's doable, but I think that there has to be the political will, and there also has to be the funding, and we haven't seen that in this country. Not for years and years, even though we've been talking about this for a long time, we haven't had the political will or the financial investment so that the data that we get oversamples the populations that are just not represented in any number, so we can't hear their voices.
Thank you for that really important note. You're absolutely right. I know that Pam Highland had her hand up and put a comment in the chat. Pam, I don't know if you would like to say it live on the Zoom. I'm also happy to read it out loud, or if maybe I'll read it out loud and you let me know if I missed anything. But Pam is asking about race as a factor in achieving economic success. I think responding to also or expanding on Carlene's question.
Yeah, sure. What happened is that the Rhode Island Foundation brought in folks from North Carolina who are experts in diversity and inclusion. And it was really eye-opening because when you compared you know, a person of color that had a master's degree against somebody, white person with a high school education, the white person still came out on top on every indicator. The same thing, even if they were paid a lot of money. So the same thing with education. The other thing that was pretty eye-opening is that when kids act out, if they're a white child, the teachers would call the parents and try to work it out. But if it was a person of color, they were reluctant to call. And so they would then get them in the juvenile justice system or social work. So it was a really, it was an eye-opening study. And I think it's, so to me, if I had to choose based on that alone, perhaps the greatest predictor really is race. We have a lot of work to do, diversity, inclusion. Get all girls to join the Girl Scouts.
Any response? Speaking of Girl Scouts, it is cookie sale time right now. My daughter.
Yes, it is.
Yeah.
Thank you.
So
Thank
would
you.
anyone like to respond to Pam's comment for our panelists?
I'm a proud Girl Scout here, so thank you for that plug. I would also add that I think that that point is well taken. There are persistent and very serious disparities in terms of health outcomes, in terms of economic well-being, and I would say that that we talk about race as a determinant, but I think that racism is the determinant. I think that there's a lot of institutional barriers for women of color, and I think that the sort of old saying that you have to work twice as hard to get half as far, I think that is like, for women of color, it's like you have to work 10 times as hard to get half as far. So I think that's it's really important that we acknowledge that, and I really appreciate you raising it, Pam.
Angela,
something else, and I'm sorry, Paige, I was just thinking that there's no data set that I know of that captures resilience and joy. And I'm just throwing that out if anybody knows of a data set, because I think we also, as women, and someone else on the panel may have mentioned this, have tremendous strengths, and all the different compositories of different data sets that I've looked at focus almost invariably on a deficit model. And I'm just throwing that out. I think the Women's Fund would be the first that I know of, if they could come up with a way of also celebrating women in some way on the launch, but I don't have a data set to suggest.
I love that idea. How do we measure joy? How do we change from this deficit model into really be measuring things that we want to see, not the things that we don't want to see, right? It's changing our vision there. So before we're going to break into small groups, but I'd love to ask just a final question to each of our panelists. A quick 30 seconds. What is the most important thing that you hope that all of our attendees walk away with today?
I can kick us off. I really hope that folks explore the index. I hope you take the time to kind of dig into all these different indicators. And I really hope my biggest sort of hope in terms of takeaways is that you think about ways that you can contribute to it. If there's data that's missing, if there's data that would lend more context to it, if you know of, as Deborah says, if you know of data sets that can speak to sort of a strengths-based approach, the sort of a more resilience model. I think that this index is such a wonderful resource, and at the same time, I think it's a work in progress, and it's something that we can continue to build on. So I'd love for folks to consider the ways that we can do that.
So I would be really happy. I know that we're in a room full of doers, right? We show up, we come to learn so we can do better. And I hope for whether or not those of us who do this work professionally or in our own communities as community organizers, I hope that we can understand a little bit more about the strengths and the opportunities for growth in our own communities. And I hope for those of us who maybe are thinking about statewide, policy initiatives or programs that we can find these areas of the state where we could pilot new ideas and really center the development of those ideas on the communities that are most impacted.
I'm going to actually answer personally. I don't normally do this, but there were periods in my life as a feminist where I really felt the personal and the professional were integrated into my life in terms of working on women's issues and the women's movement and so forth. And I have found in the past number of years, work, either the way I do work, I just find work so more demanding that I often don't make the space to do the kind of political work separate from my paid work that I had found so nourishing. I just share that because I imagine that if I step back, I really could reorganize my time and my effort and get back into that. But I wonder if other people on this panel also feel how other people are balancing activism and paid work and our family obligations. And at various times I feel I have done it well and maybe not so well now in terms of a balance. But I actually would like to hear from other people. Maybe that'll happen in the chat because I think these are particularly hard times. I've never lived through a pandemic, but it's this balance that I'm finding difficult to find actually predates the pandemic. So I actually would like to learn from other people and hear other people's perspective.
Deborah, that is an absolutely beautiful closing and a wonderful segue into our next section, which will be small group discussion. So maybe we can bring that into that discussion. So I'll pass it over to Kelly, who will give us directions on what's next. But thank you so much to our wonderful panel. I've learned so much from each of you and excited to continue to do this work together. So thank you, Kelly.
Thank you. Actually, I'm going to pass this over to Sid, who is one of the key architects of this research, and she will give us the next set of instructions. Sid?
Hi, everyone. My name is Sid, and I am so excited to be a part of this index launch. This has been a labor of love over several months. Currently, I work in the biotech industry, and I feel very privileged. Being a woman of color and working in STEM, it's always been important for me to work toward closing the gap and bringing equity to women. The first step in understanding the disparity is to gather the data. And that's what I started helping out with in June of 2020. Me and several other volunteers helped to populate the various data sets that go into each measure. I also helped sustain an up-to-date spreadsheet that kind of became a single source of truth. And it made its journey through what the index looks like now with the help of some super talented and dedicated folks. While each individual had their own methodology, I would start by looking up the measure in the census database, and that would usually point me towards the state and the national level of data. And as alluded to by Nishi earlier, as we progressed through the measures, certain data was harder to come by for the town and the county level. There are certain measures that are missing data, and the team is working to fill these blanks to bring the whole truth to the index. And so if anyone here is interested in just discussing this in detail or has any potential leads, we would love for you to reach out. And with that, I would like to introduce the prompts for the breakout rooms. I'm also going to be putting the prompts in the chat box here, so y'all can take a look at it. We will break out into rooms for 15 minutes with a panel member in each room to guide the conversation. Some prompts to make the conversation flow are: what data was surprising to you? What information would you like to see in a future version of the index? And how are you going to personally use this index? I'm hoping there are some great insights that come out of this, because I think a lot of people have shared some great stuff on the chat, and I'm sure this is going to be a good conversation in the breakout rooms. So I'll pass it off now. So off we go.